What does it mean to have pain in the back of the head? I want to shed light on a condition that often goes unnoticed or even misdiagnosed: occipital neuralgia. This is Dr. Baker. I'm a board-certified neurosurgeon. While many of us are familiar with headache and migraine, occipital neuralgia specifically is a type of headache that stems from irritation or injury to occipital nerve, which is back of the head, basically the scalp area in the back of the head. Occipital neuralgia is characterized by sharp shooting pain that typically starts from the base of the skull, bottom of the skull right here, radiates towards the scalp, often described as a jolt of electricity. This can be debilitating and is frequently mistaken for other types of disorders like migraine and others. It's triggered by activities such as touch or just any type of contact over this area. What are some of the causes for occipital neuralgia? Any type of neck injury or trauma to this part of the head, because the nerve kind of hangs out in the back of the head right there. If you have any kind of compression, any kind of inflammatory disorder, this can trigger irritation of the nerve. It can also be due to muscle tension in the back of the neck that can exert pressure over the occipital nerve as the muscles are tense and they're trying to protect the neck from injuring itself. But as a secondary effect of that, it causes irritation of the nerve, which can manifest as occipital neuralgia. I had a patient who came to me with complaints of headache and was seen by a neurologist and tried a whole bunch of different medicines. And when she came to me, she described very classic features of occipital nerve problem. So I obviously tried something called a peripheral nerve stimulator trial, which was amazing. It immediately relieved all her problem with the occipital nerve. I can also do a diagnostic block of this nerve to confirm that this is the problem. In general, though, you want to try starting with medications like anticonvulsants or anti-inflammatory medicine. Physical therapy can be helpful in correcting the posture or alleviating muscle tension that may be causing secondary occipital neuralgia. Nerve blocks, which is temporary sort of injection of steroids or numbing medicine, it's not permanent. And of course, peripheral nerve stimulator trial, if it's effective, then you could put a permanent peripheral nerve stimulator for the cervical plexus to treat the occipital nerve. And last resort is major surgery. You can do direct decompression of the occipital nerve, or you can do something called C2 ganglionectomy, the most invasive way to treat occipital neuralgia, which would then render the person completely numb in the back of the head, and not something I'd recommend. I hope this was helpful. If you like what you heard, please follow for more.